Welcome back to Ozarks Fox AM. We are here with Eric Rivas. He's one of the owners of a hip joint, and he's going to demonstrate some acupuncture because Jeremy has never had any. So how you feeling?
I'm excited. Now, being a chiropractor, is that a doctor? You're a doctor then?
Yes, sir.
Yes, so
Yep.
yes. Okay, just want to make sure. You're Dr. Eric.
Dr. Eric.
I feel like I'm in good hands. I feel like I'm in good hands then.
I'm sure you are. All right, Dr. Eric, where do you want to start?
Well, as far as for acupuncture on the show, the easiest places to do it is going to be hands and feet, just for ease of access.
Okay.
Most of the time when they're in the office, it's in the back or legs or feet,
right,
and things depending on where we're treating.
Well, let me ask you real quick before you get started. How do you decide where to treat? Do you take the pulses? How do you decide?
So we can do it in different manners. We can do pulses, depends on what we're treating. So the great thing about acupuncture is it lends itself to many different issues that we're working with. So we can do hands and feet if we're working on meridians, which would be pulse,
right,
or we can have somebody come in and they hurt their back, so we're just going to work on the back.
Gotcha. Sometimes people know what they need.
Exactly.
All right.
Yes. Yeah.
Very good.
And so then we would just kind of change the treatment based on the patient coming in.
All right. Well, I don't want to disturb you while you start to work on him, but I do have a few questions. If you want to go ahead.
Yep. Bring them on if you want to while I'm working here.
Yeah. What are you going to work on with Jeremy here?
So just because we can see it easiest, I'm going to do some points on the hand, and then we're going to do a couple on the face.
Do I need to have I've never done this before, so I don't know. Do I just relax my hand and sit it down, or do I need to lift it to you?
No, just keep everything relaxed.
Okay.
You don't want to get the muscles involved.
Okay.
If you try to move the hand, that muscle will contract, and it'll just make it pinch.
Okay.
For the most part, acupuncture is painless. There are some points to where it can pinch, or the muscle can contract, feel like a little Charlie horse, but for the most part, it's painless.
Yeah.
So, and you've had it.
I've had it my whole life, honestly.
Okay,
and so now I'm going to disagree with you for a moment, just because there have been some really spots that have needed it terribly on me that have hurt a little bit.
Yes.
And I'm like, you know, I feel like I really must have needed that point.
Right, exactly.
But
and
it
you
goes
tell.
away after it's in.
And then it also depends on where in the body we're needling, too.
Right.
So there's sensitive places, hands and feet are sensitive. Face is a little less sensitive. But then on the back, I mean, there's points on there that you wouldn't know that we
wouldn't
even did anything
It's like,
to
is
you.
it in? You don't even know.
Yes, exactly.
Yeah.
It just feels
Dr.
like
Eric,
we
I'm
pressed
glad you're
you.
starting with my hands because there's a pressure point that you can. I had a tension headache all day yesterday. Could not get rid of it because I was working on my house and I was lifting my neck up the whole time and I couldn't get my neck. So I'm glad you're doing this on my hands to maybe help that headache.
Yes.
Okay.
And I think a lot of people have heard that when you pinch in between your thumb and your finger to release a headache. So that's your first one.
Oh my gosh, I didn't
You
even
didn't
feel
even
it.
feel that.
I didn't even feel it.
Isn't that something?
They're such small needles, and the procedure's so quick that most of the time you don't feel anything.
I did not even feel that. Oh
Now, how long do you usually leave them in?
We try to get at least 20, 30 minutes.
Okay, now that one, guess what?
That was a little bite on that one?
I felt that one just because I think of my headache yesterday. I feel like I need it in this one.
Okay, yeah. That's
like
kind of
what you were saying.
Yeah,
Yeah,
that's what I was saying. But then again, as it's in now, the pain goes. It was just the initial.
Yeah.
Did it fade?
It's fading.
Fading, yes.
It is fading. I'm like, I'm not going to move.
All right.
I don't want to move.
So I'm going to do a couple points here. These are really good sinus points.
Right.
So we've got people coming in with allergies
Lots
or
of
their
allergies
sinuses
right now.
are clogged up. These are points that we would use to drain them.
Very good.
Now, viewers, he's using alcoholic swabs on my face, and I wear show makeup for the show, so don't be alarmed.
He's being very gentle with those
Try not to wipe it all away.
Okay.
Because, the lights get hot. I'm a little nervous on
I can feel
I'm
your
going to step behind you here. How about that?
Did not feel it.
All right.
Yeah, I really
Very
didn't feel that
good.
one. Now, this is helping my sinuses.
These are sinus points. So again, if you get headaches because your
can get that in
sinuses, these are points that we would use.
And do you recommend not moving or talking during this?
No, actually, you can move around. They're not going to go anywhere. You can talk, you can move.
Okay.
Yep. I've got people that, in the middle of a treatment, are like, I got to go to the restroom.
Oh, seriously?
So they'll jump up and run to the restroom with needles in them.
Very
We
good.
may have to follow the trail of needles as they fall out of them.
very
But
good.
I feel like an insect.
Yeah,
I'm going to step around this other side
I'm going to
on
get
you.
out of the way here.
I'm going to do it right underneath your eye here,
Okay.
on your cheekbone.
I feel like sinuses have been really intense this year. For me, I don't know if there's something new going on in the world.
I don't know if it's so much new. It's just I think a lot of people with stress has made it easier for the allergies to get people that typically wouldn't get them.
Right, I agree with that.
Does this make you look like relaxed, and does it get rid of wrinkles?
Actually, there is something to be said for the cosmetic side.
Yeah.
I'm
Because
curious
it
about
does
that.
increase blood flow to the area, so it helps to fill the skin up, and it does help a little bit with collagen regeneration. So there is a whole subset of acupuncture
That's
for...
kind of side effects, good side effects,
Yes,
right?
exactly.
Yeah, there you go.
Yeah.
So, Dr. Eric, we have about a minute left. Do you want to hit some points on my neck, or do we not have time?
That's up to you. I can keep
wanna
going if you
because
want
I
to
had
keep
that
going.
headache so bad yesterday.
Yeah.
I'm just gonna
And
turn
while
it
you're
on.
doing that, I'd like to just cover real quick some of your chiropractic, because you have
Yes.
3 doctors there in the office, and I did go in, and the first thing they did was just kind of scan my body and look at that. And I've been to chiropractic folks most of my life, and I just felt comfortable. I felt like he really knew what he was doing, what he
Very
was
good.
looking for, and so we're running out of time, but this is so interesting.
This is so fascinating.
We've-
And you have 2 locations and you have great prices. Can you tell us about that?
We do have 2 locations. So we have one on East Republic Road and one on Jefferson Street just off of the square.
Right.
We have a membership model, so you can come in a la carte and pay as you go, or you can get onto one of our memberships too.
Okay, really great prices, guys. Go make an appointment. It's going to help you out, I promise that. All right, we'll be back right after this.
I feel better already!
Already, Jeremy.
My headache is gone, Kelly!
Is it gone?